CCRN Endocrine practice test questions and answers and explanations. 35 difficult questions. Question 1. A patient with diabetes insipidus, D, will typically exhibit which of the following laboratory findings? High urine-specific gravity, low serum sodium, high serum osmolality, low urine output. D involves a deficiency of ADH, leading to excessive water loss, polyuria, which causes high serum osmolality and low urine-specific gravity. Question 2. Which treatment is standard for syndrome of inappropriate antidiuretic hormone, SIADH? Fluid bolus of normal saline, fluid restriction, administration of desmopressin, DAP, high carbohydrate diet. SIADH involves too much ADH, causing water retention and hyponatremia. Fluid restriction is the primary treatment. Question 3. Which electrolyte imbalance is most commonly associated with SIADH? Hypernatremia, hyponatremia, hyperkalemia, hypocalcemia. The excessive water retention in SIADH dilutes serum sodium, leading to dilutional hyponatremia. Question 4. A patient in DKA, diabetic ketoacidosis, will likely have which acid-base imbalance? Metabolic alkalosis, respiratory acidosis, metabolic acidosis, respiratory alkalosis. DKA causes an accumulation of ketones, acidic, leading to an increased anion gap metabolic acidosis. Question 5. What is the primary difference between DKA and HHS, hyperglycemic hyperosmolar state? HHS involves higher blood glucose and no ketones. DKA involves higher blood glucose and no ketones. HHS always presents with metabolic acidosis. DKA only occurs in type 2 diabetes. HHS typically has much higher glucose levels, often greater than 600 mg/dl, but lacks significant ketosis because there is enough insulin to prevent lipolysis. Question 6. Trousseau's and Cross-Dex signs are clinical indicators of which electrolyte imbalance? Hypercalcemia, hypocalcemia, hypermagnesemia, hypokalemia. Hypocalcemia increases neuromuscular excitability, leading to these signs: Cross-Dex, facial twitch; Trousseau's, carpal spasm with BP cuff. Question 7. What is the priority intervention for a patient in myxedema coma? Cooling blankets, intravenous levothyroxine and airway support, fluid restriction, beta blockers. Myxedema coma is severe hypothyroidism. Treatment includes thyroid hormone replacement, Revarmang, and respiratory support. Question 8. Thyroid storm is characterized by which of the following? Bradycardia and hypothermia, tachycardia, hyperthermia, and agitation, hypotension and lethargy, high TSH levels. Thyroid storm is an extreme state of hyperthyroidism, thyrotoxicosis, presenting as a hypermetabolic state. Question 9. Which medication is typically given to manage the cardiovascular symptoms of thyroid storm? Levothyroxine, propranolol, hydrocortisone, amiodarone. Beta blockers like propranolol are used to control the life-threatening tachycardia and hypertension in thyroid storm. Question 10. Patients with Addison's disease, adrenal insufficiency, require which type of replacement therapy? Insulin, glucocorticoids and mineralocorticoids, vasopressin, parathyroid hormone. Addison's is a deficiency in cortisol, glucocorticoid, and aldosterone, mineralocorticoid. Question 11. A patient with Cushing's syndrome is likely to have which physical characteristic? Extreme weight loss, buffalo hump and moon face, bronze-colored skin, exophthalmos. Cushing's, excess cortisol, causes central obesity, buffalo hump, and a rounded moon face. Bronze skin is seen in Addison's. Question 12. What is the typical urine-specific gravity in a patient with diabetes insipidus? 1.001 to 1.005, 1.015 to 1.025, 1.030 to 1.040. It is not affected. D causes very dilute urine with low specific gravity, often 1.005. Question 13. Pheochromocytoma is a tumor of the adrenal medulla that secretes excess cortisol, catecholamines, epinephrine/norepinephrine, aldosterone, ADH. Pheochromocytoma causes surges of catecholamines, leading to severe hypertension and headaches. Question 14. In the management of DKA, when should glucose be added to the 4 fluids? When the glucose drops below 250 to 300 mg/dl, immediately upon arrival, only if the patient becomes hypoglycemic. Never. Dextrose is added to the 4 fluids once glucose reaches 250 mg/dl to prevent hypoglycemia and allow continued insulin infusion to resolve ketosis. Question 15. Which medication is an ADH analog used to treat central diabetes insipidus? Furosemide, desmopressin, DAV, spironolactone, methimazole. DAV replaces the missing ADH in patients with central D. Question 16. Which gland is known as the master gland because it regulates many other endocrine glands? Thyroid, pituitary, adrenal, pancreas. The pituitary gland secretes hormones that control the thyroid, adrenals, and gonads. Question 17. What is the hallmark laboratory finding of primary hyperparathyroidism? Hypocalcemia, hypercalcemia, hyperkalemia, hypomagnesemia. Excess PTH causes increased calcium release from bones and reabsorption by kidneys, leading to hypercalcemia. Question 18. Which type of insulin is used for continuous 4 infusion in DKA? NPH, regular, Glargine, Lispro. Regular insulin is the only insulin typically given intravenously for DKA management. Question 19. Severe hyponatremia, 120 milliequivalent/L, in SIADH puts the patient at highest risk for cardiac arrest, seizures and cerebral edema, pulmonary embolism, acute kidney injury. Rapid or severe hyponatremia causes water to shift into brain cells, leading to cerebral edema and seizures. Question 20. A thyroid storm can be triggered by which event? Stress, infection, or surgery? Eating too many vegetables, excessive sleep, drinking too much water. Thyroid storm is often precipitated by a stressful event, infection, or trauma in a patient with underlying hyperthyroidism.